Greetings to everyone attending this year's World Health Assembly. And
climate change is killing us. 7 million people are killed by air pollution each year, 1 in 8 of all deaths. Emerging diseases are increasing as we continue to encroach on nature. Extreme climate events are increasing in frequency and intensity, and it is only getting worse. The climate crisis is a health crisis. But we can do something about it, and it will not cost the Earth.
So what is the cost? It's all about common sense, non-regrets, very good investments to protect the health of our people now and clearly for a sustainable future with very good economic returns as well.
We must protect and preserve the source of human health, nature, and invest in essential services from water and sanitation to clean energy in healthcare facilities. Stop using taxpayers' money to fund pollution and ensure a quick, healthy energy transition. And build healthy, livable cities and promote healthy, sustainable food systems.
As the global health community, there is no way we can escape to be part of the solutions. Not only to be part, we will be the leaders of this because only the health argument can motivate the type of important action that we need on tackling the causes of climate change.
This is the most important fight of our time. We must protect our climate, our health, our future.
Welcome everybody, my name is Richard Horton, I work at a medical journal, The Lancet, and what a momentous week it has been. World Health Organization made climate and health one of the agency's 6 strategic objectives for 2025 to 28. That is a milestone in the history of global health. And member states approved a far-reaching resolution on climate and health. But we also should recognize that we meet at a time when the impacts of the climate crisis are all too tangible and life-limiting for communities. Just one example, a record-breaking heat wave in Delhi this week spreading across India with temperatures approaching 50 degrees Celsius, prompting the rationing of water and bringing most activity in the city to a halt. The reality is that climate change is disproportionately affecting the most vulnerable communities in every country in the world, threatening to reverse progress in health and sustainable development. Our actions to diminish global heating will deliver major health dividends, as well as ameliorating the environmental and social determinants of health, from reducing air pollution to adopting healthier diets. Today, we are going to review the outcomes of recent Conference of Party meetings. We're going to try and outline a plan to support countries to advance action on their commitments from those COPs. And we're also going to try to identify ways to accelerate momentum and strengthen collaboration on our global vision for action on the climate crisis. To begin, it's my great pleasure and honor to introduce the person who has put the World Health Organization on the front lines of the struggle against the climate crisis. Please welcome Dr. Tedros.
Thank you, Richard. Sorry for my voice. Thank you, Richard, for joining us. I know how busy you are, but not only that, thank you so much also for your leadership on global health, consistently pushing. So we're proud of you. Thank you so much, Richard. Honorable Minister Dr. Taimur Musayev, Honorable Minister Dr. Antonio Lalabalavu, Honorable Minister Filmona Gonçalves, Secretary General Celeste Saulo, Dr. Adnan Amin, and again our moderator Richard Horton, Honorable Ministers, distinguished guests, dear colleagues and friends. Thank you all for joining us today. And my thanks also to former Vice President Al Gore and Nigar Arpadarai, UN Climate Change Health Level Champion for COP29, for sending video messages, which we will see shortly. The climate crisis is a health crisis, and it's not a hypothetical crisis in the future. It's right here and right now, as Richard already gave us latest example from India. Climate-related humanitarian emergencies are increasing in scale, frequency, and intensity. In the last month, there have been record heat waves across Mexico and devastating floods in Brazil. Each year, air pollution contributes to over 7 million premature deaths. Rising seas are edging closer to submerging some of our member states. Food insecurity is rising, forcing people to make impossible choices between their next meal and health care. And climate change is also fueling the spread of diseases like cholera, dengue, and malaria. The health gains from climate mitigation and adaptation outweigh the costs and are a compelling argument for stronger climate action. Climate action could save millions of lives each year and generate a return of over $4 for every dollar spent. These actions include protecting vulnerable people from the health impacts of heat waves, investing in renewable energy for health facilities, and removing subsidies from polluting fuels. We also need to invest in health and care workers to meet the increasing demands on health systems caused by climate change. For all of these reasons, climate change is a key component of the 14th General Program of Work, which member states approved last Tuesday, as Richard already indicated earlier. I also welcome the resolution on climate change and health that member states have approved. In March next year, we will hold the second WHO Global Conference on Air Pollution and Health in Colombia, bringing together global leaders and experts to focus on concrete solutions to improve air quality, mitigate climate change, and protect public health. We're very pleased that health is becoming more prominent in climate discussions globally. At COP28 in the UAE last year, as you know, a whole day of program was dedicated to health for the first time, and almost 150 countries signed the Ministerial Declaration on Climate and Health. We very much hope health will remain a priority under Azerbaijan's presidency, and Minister will speak to that. And I'm also pleased that multilateral development banks, donors, and philanthropists are prioritizing climate. Thank you all for your commitment on this issue and to protecting and promoting the health of both people and planet. I thank you.
And now we have a short video from Al Gore.
Greetings to everyone attending this year's World Health Assembly. And thank you very much for allowing me to attend virtually. And let me especially thank the Director General and the entire World Health Organization for inviting me to give this short message about the intersection of the climate crisis and human health. As the WHO has long since declared, the climate crisis is now the biggest health threat facing humanity. And it's one that disproportionately harms the most vulnerable people on our planet. To begin with, worldwide, the co-pollution in our air from the burning of fossil fuels, the particulate pollution, kills an estimated 8.7 million people each year. There's a range of estimates. That's the one I think is the best, but it's unacceptably high among any of the estimates that you find. And by continuing to use our sky as if it's an open sewer, we're putting even more lives at risk as our planet continues to warm. When I use the word sky, I'm referring to this thin blue line that surrounds the Earth as a thin shell that you see on the picture behind me that the astronauts bring back from space. That line is blue because that's where the oxygen is that refracts the light, and it's so thin that if we could drive a car straight up in the air at interstate highway speeds, we'd get to the top of that thin blue line in about 5 to 7 minutes. And the heat-trapping pollution accumulates there and traps so much heat that now in the tropics and subtropics, the combination of that heat and the extra humidity evaporating off the warmer oceans held in larger quantities by the warmer air is now causing many areas to become physiologically unlivable. The areas that are uninhabitable now are relatively small, but unless we stop the use of the sky as an open sewer, unless we stop the buildup of this heat-trapping pollution, those areas that are physiologically unlivable are predicted to expand, and billions of people will find themselves living in areas where it's no longer safe to stay outside for more than a couple of hours. And of course, that mobilizes climate refugees in much larger numbers. In addition, vector-borne diseases are now spreading from the tropics into new regions, poleward, north and south, and waterborne diseases are becoming increasingly common as communities deal with flooding from large precipitation events. And as the climate changes and humans expand further into Earth's remaining wild places, we're now seeing 5 new infectious diseases emerging on average each year. You are all gathered here today because you know the stakes and you are seeking to develop new collaborations and initiatives to address this growing challenge. I'm here simply to encourage you to act with urgency and to remind you that just as important as the work is that you're doing to improve global health outcomes is your work to prescribe the solution. We need the voices of doctors and public health experts and officials to call for action loudly and clearly, action that transitions our world away from the unhealthy practice of burning fossil fuels as quickly as possible. You are among the most trusted voices on this planet. And we know from multiple studies over many years that your messages are one of the most powerful sets of messages and the most persuasive kind of message that people hear. So thank you, because this is a crucial time, the most important decade for action on the climate crisis in any of our lifetimes. So let's get to work. Thank you.
So the former Vice President of the United States has given us a compelling mandate, and we have a stellar group of speakers now who are going to map out for you a global vision for action on the climate emergency. And we begin, and it's a great honor for me to start by introducing Dr. Teimour Musayev, Minister of Healthcare of the Azerbaijan Republic. Dr. Musayev, you're going to give your vision for COP29.
Dear Dr. Tedros, Your Excellencies, distinguished guests, ladies and gentlemen. Today, people are already experiencing direct and indirect impacts of climate change. The frequency and severity of extreme weather events, such as floods, droughts, storms, have increased over the last decades. These climate events have indirect effects on air quality, water pollution, and land use opportunities. Many prevalent human diseases are linked to climate fluctuations due to heat waves, transmission of infectious diseases, and malnutrition. Around a third of heat-related deaths are already attributable to climate change, and the number of extreme weather disasters driven by climate change has increased fivefold over the past 50 years. Heat-related illnesses are on the rise. Higher temperatures are linked to an increase in allergens and harmful pollutants in the air. More and larger wildfires reduce air quality and increase smoke exposure, which cause more respiratory and cardiovascular hospitalizations. Extreme weather events create ideal conditions for infectious diseases to spread. Diseases that were once confined to warmer regions are also expanding their range. Rising temperature threatens water and food security as well. The expansion of waterborne infections is occurring in many regions. Unfortunately, awareness of healthcare professionals about the impact of climate change on health is not at satisfactory level. Health literature assessing the effectiveness and setting prioritization of interventions is lacking. It's suggested to include the subject on climate change and health into the teaching curricula. I would like to mention that from this year, we in Azerbaijan Medical University included the curricula as a module related to the impact of climate change on human health for second-year medical students. WHO Academy could play a pivotal role in creating an online platform to provide continuous education on climate change and health. Public health professionals should disseminate climate change impact on physical and mental health among communities. Working in partnership with the communities most affected will support science-based solutions for taking on this urgent health challenge. Healthcare systems significantly contribute to carbon dioxide emissions. To mitigate new climate challenges will necessitate a comprehensive health system transformation. However, several issues such as regulatory compliance, financial constraints, cultural resistance, remain major challenges in implementation of the concepts of green hospitals and healthy cities. Dear esteemed audience, 2024 is announced the Year of Solidarity for a Green World in Azerbaijan, and several events organized at national and global scale address the adverse impact of climate change and advance climate actions. Despite being an oil-rich country, Azerbaijan is always committed to the green agenda. Its obvious proof is to host COP29 conference scheduled for November this year. Our health is closely linked to the environment we live within. Without timely intervention, it will have catastrophic consequences. Governments need to be prepared to deal with future climate-related impacts. Developing countries, especially least developed countries and small island countries, should be supported financially. We believe that 4 years NAM chairmanship will allow Azerbaijan to play a role of bridge builder and to reconcile positions of both developed and developing countries to agree on new collective quantified goal in Baku COP. In conclusion, I call the world community to act quickly and decisively to avoid the worst impacts of climate on health. Thank you for your attention.
Thank you so much for your remarks. As we all know, small island states are among some of the most vulnerable countries to the climate crisis, despite contributing the least to the challenge. So it gives me particular pleasure to welcome Dr. Antonio Lalabalavu, who is the Minister of Health and Medical Services for Fiji.
Thank you, Richard. Bolovinaka, and very good afternoon to to all of you. Indeed, we are extremely delighted that the climate change and health resolution was adopted by consensus earlier this week at the Assembly. An important outcome of the resolution is that it asks WHO Secretariat to develop a first ever global plan of action on climate change and health, and to accelerate actions on climate change and health within the new GPW. This is extremely important for Fiji and the Pacific as well. The impacts of climate change are visible and tangible, and having a resilient health system infrastructure is essential in serving our people. We are the first in the region to develop our very own guidelines for climate resilient and environmentally sustainable healthcare facilities, and we are guided by WHO's climate resilient and environmentally sustainable healthcare facilities that was launched in 2022. The mandate for the development of the new Global Plan of Action on Climate Change and Health is the newly adopted resolution, which allows us to strengthen our efforts on climate change and health within the new General Program of Work. We also appreciate the recognition of the distinct vulnerabilities and disproportionate impacts of climate changes in small island development states. This raises the climate change and health to the highest level of priorities at the global level, and we will work with WHO and our development partners to translate that level of priority to our national context, particularly focusing on building a climate-resilient health system. You know that building resilience and fortifying our health systems costs money. And we know that fragmented funding mechanisms and sliced approaches hinder our efforts, especially for small island development states, who find it difficult to access funding mechanisms successfully, to act and address complex climate and health challenges effectively. We support WHO's efforts to promote a coherent and coordinate responses to drive action in implementing our climate and health commitments, including through advocacy, awareness raising, provision of country support, and mobilization of finance. To conclude, we welcome the outcome of the Seeds for Conference on the Antigua and Barbuda agenda for seeds that puts forth a new, ambitious pathway for small island development states' sustainable development and expresses small island development states' commitment to reform the international financial architecture and address gaps and shortfalls and facilitate easier access to affordable and concessional finance. And I thank you.
Thank you so much. Last year's Dubai Climate Conference was an historic moment with the first ever Health Day and 150 countries signing the Ministerial Declaration on Health and Climate. I'm not sure who the 40 other countries are who didn't sign, but they should be ashamed of themselves. It's a great pleasure to introduce Adnan Zaid Amin, the Chief Executive Officer of COP28, to tell us how he and his country are promoting the implementation of those country commitments.
Thank you very much, Mr. Moderator. And let me start by recalling that it was almost exactly 1 year ago in this room where we posited the idea of a first Health Day as a thematic day at a COP, and the first ever ministerial to take place at a COP, a Health and Climate Ministerial. We had been in a very intensive process of preparing for the COP, and in addition to the complex negotiation that we had to deal with, which was the first ever global stocktake, we were also trying to take stock of where are the key threats of climate change impacting the human community, and how do we create a much broader framework of inclusion of the critical factors on climate in a COP framework that is bigger than just the negotiated outcome. And our sense was that health and climate was one of those issues. We had been seeing accelerating trends of degradation. We saw this as an emerging threat, We had great support. Dr. Rand from our Ministry of Health is here in terms of our own assessment of how we were looking at this threat. And we came to you a year ago to suggest that we should have the world a ministerial at COP and a health day at COP. And we were just bowled over by the enthusiasm and the excitement for that process to happen, and the level of engagement that all of you took part in, building up to that COP, which ended up, as Richard said, in an extraordinary ministerial. We had 50 health ministers. I think of all the 28 COPs that had taken place, there were more health ministers that attended COP28 than had attended the entirety of all of the other COPs, really bringing the issue to the front and center of climate action, adopting a declaration that has been extraordinarily impactful. 150 countries, the others are interested, Richard, they will come, because I think everybody sees the importance of this with the events that we're seeing. Dr. Tedros, Mr. Gore, and others, and the minister from Fiji have talked about all of these impacts. I won't go more into that except to say that we are aware of the severity of the situation and the need for a response. And that's why we're also delighted this year, not only to come back to thank you for your engagement and to talk about the significance of the program looking forward, but also to celebrate with you the success of the adoption of this new resolution on climate and health at the World Health Assembly, which I think is highly significant. And I think there are many elements that came out of the declaration, the ministerial declaration, that we see reflected in this. So this kind of continuity of action, building on success, and looking to the future in terms of how we really create impact has to be at the heart of everything we do on climate and health from now on. And I have no doubt that with the leadership role that WHO is playing, with all your support, that we'll start to move in this direction. And I want to thank very much Peru and the Netherlands for facilitating this resolution, which we were delighted to co-sponsor, and the promise that it holds for the future. We're now moving into a phase in our presidency here as COP28, where we want to start to look at solutions rather than continuing to analyze what the problems are. We are very clear of what the problems are. At the base of a solution focus has to be the question of finance. We put tremendous emphasis on finance at COP28. We brought a lot of finance providers, governments together. We created a framework that at COP28 itself raised $1 billion for investment in climate and health initiatives. And we have now launched the guiding principles for financing climate and health solutions, where 40 international financial institutions have signed on. We believe that we are creating a much better knowledge framework for investment in climate and health. We think that not only is there a social and political case for investing in climate and health, but there is a business case for doing that. And as we go forward, that has to be one of the elements that really starts to leverage financing at the levels that we need. And how do we develop collaborative financial ecosystem in the future that supports this. We're now also, the second leg of the implementation is that at COP28 we established and created a Troika framework for the first time of 3 presidencies, ourselves, the incoming presidency of COP29, Azerbaijan, and Brazil as a COP30 presidency. The ambition of that Troika is really to focus on what we call Mission 1.5. How do we achieve the North Star of 1.5 alignment, which is the minimal level that we need to assure a sustainable lifestyle on our planet? And how do we really leverage the NDCs and the national adaptation plans in the future? So the focus of the Troika has been to work with countries to raise ambition on the NDCs and the NAPs, and we have asked the Secretary General of the UN also to indicate how the UN system will be providing the technical support to countries to raise ambition in NDCs, and we will be hearing from the UN in the next few days in Bonn in terms of how that response is going to be shaping up. So things have started to move, but let me say I was very much looking forward to meeting Her Excellency the Minister of Health of Brazil on this occasion. And when I came here, I realized, I heard that she had not come because she had remained behind in Brazil because of the floods. And I was also told of the extraordinary dengue outbreak that had taken place previously, both of these related to the trends of climate change that we see happening around us. So this brings home to us the importance of this. Our commitment is to action, and we are looking forward to our continued partnership with all of you going forward. Thank you.
Thank you so much. Let's continue with our exploration of the threats to some of the most vulnerable communities in the world. And it's a great pleasure for me to introduce Dr. Filomena Gonçalves, who is the Minister of Health of Cape Verde. Dr. Gonçalves, please, to you.
Your Excellencies, distinguished guests, and esteemed colleagues, it is an honor to be here today to address a topic of critical importance, the impact of climate change on health, with a special focus on a small island developing states, seeds, such as Cabo Verde. Cabo Verde, an archipelago of 10 islands in West Africa, directly confronts the challenge and the vulnerabilities arising from climate change. Cabo Verde has proactively integrated climate consideration into its health policy. In 2021, we update our national determined contribution by including health as a strategic axis in the areas of mitigation and adaptation. Our commitment to the One Health strategy reflects a holistic approach combining human, animal, and environmental health to address health risks and respond to future epidemics. Main health impacts: vector-borne disease. With rising temperatures and change in precipitation patterns, we have seen an increase in the prevalence of diseases such as dengue. Natural disasters. Our population is increasingly exposed to floods, storms, and droughts, which directly affect public health, food and water security. Irregular rainfall and rising temperatures contribute to food insecurity and water scarcity, impacting the nutrition and health of our communities. Respiratory disease. Air quality made worse by dust from the Sahara deserts and vehicle emissions, along with indoor pollution from traditional stoves, results in respiratory disease and increase in skin cancer due to intense sun exposure. Strategic and objectives. To address this challenge, Cabo Verde has developed several strategic actions. National Plan for Health and Climate Change. By 2025, integrate climate consideration into our national One Health strategy to combat health risks and respond to the future epidemics. Monitoring and data. Create a comprehensive profile of Cabo Verde to climate change and health, improving the national database, monitor climate-related disease, and identify vulnerability groups, health co-benefits, and greenhouse gas reduction, municipal capacity building, awareness campaigns, resilience health infrastructures, scientific research, best practices and innovation. Inspired by international best practices, we focus on collaboration and innovation, multi-sectorial collaboration, partnership between ministries. Technology and innovation, use of advanced technology for environmental and health monitoring and implementation of early warning system, education and capacity building, continuing education program for health professionals on the impacts of climate change. Conclusion, Cabo Verde is deeply committed to addressing the health challenge posed by climate change through integrated innovation and collaboration. Together, we can create a healthy, more sustainable future for all. Thank you for your attention.
Thank you for that eloquent but chilling summary of the threats that you're facing with human health. Let me come to our next speaker, and it's in this world of threats to human health from climate, it is so important for us to take an interdisciplinary approach. We in the health community alone are not going to be able to solve the challenges that we face. So it's hugely with gratitude that I welcome Professor Celeste Saulo, the Secretary General of the World Meteorological Organization, to discuss the opportunities for collaboration between the health and meteorological communities. Professor Saulo.
Thank you very much. Good day to everyone. Thank you for your nice introduction. Dear Director General, honorable ministers, esteemed audience, the World Meteorological Organization is sounding the red alert. As the authoritative voice of weather, water, and climate, we are monitoring the Earth system and watching the world get even closer to the 1.5 lower limit of the Paris Agreement on climate change. 2023 was by far the hottest year on record. That trend has continued so far in 2024, and the increasing global temperatures are driving more extreme weather. The pace of climate change is accelerating quickly, and it affects everyone, everywhere. The climate crisis is the defining challenge that humanity faces. It is closely intertwined with the inequality crisis, as witnessed by growing food insecurity and population displacement, and the greatest health impact affect the already most vulnerable people. It is true that we are devastated when we see the damage and lives lost in the catastrophic floods, like in Brazil right now. Our heart goes out to them. But extreme heat is killing and making people sick everywhere without us taking notice. Heat is the silent killer, taking up to 500,000 lives a year. It has been almost 50 degrees in New Delhi this week, paralyzing the country. This is not livable. And hundreds of millions of people are suffering both indoors and outdoors. Dangerous heat is making people sick and putting immense strain on hospitals, on communities, and families. This situation is only going to become more common as the climate warms, also driving more drought, wildfires, and poor air quality. Climate change is sabotaging people's health and setting back public health progress. This is not the future we want for our children. We are grateful to the commitment of WHO and its members to reduce greenhouse gas emissions of the health sector. But we have to work harder and faster to slash emissions and move to a cleaner, healthier future. The cost of climate action now is so much cheaper than the cost of inaction to our future. There are so many steps we can take now. WHO has just found that heat health warning system can save almost 100,000 lives a year if we can tell the public when the hot weather is dangerous and how to stay safe. And yet, only 26 ministries of health report to WHO they have a heat health warning system. WMO represent an extensive global network of meteorological agencies and climate scientists. They stand ready to work with the health sector to better understand how and when the weather and climate will be dangerous. How many of you know your meteorological services? The WMO State of Climate Services for Health report issued last year in collaboration with WHO showed that 74% of the national meteorological services provide climate data to the health sector, but only 23% of ministries of health are using this information for health surveillance. This gap is too big. National meteorological services can be your frontline partners to plan and become more resilient to extreme weather and climate change impacts. They provide reliable and robust data, information, and authoritative early warnings. We can help you understand how diseases may change and when health emergency may occur, but our collaborations need to go deeper. It should be obvious that without climate data, information, and services, members will be lost in our efforts to become more resilient and adapt to the risks. But we need to make sure that climate data is available, safeguarded, continuous, and quality controlled worldwide, and climate information is helping you make better decisions. We are proud that WHO and WMO already work closely through our Joint Office on Health and Climate and Global Atmosphere Watch. Together, we have a new 10-year strategy to support the health community, learn about climate, build better heat water warning systems, conduct vulnerability and adaptation assessment, and meet the national determined contributions. Because there can be no health for all, there can be no early warnings for all unless we work together. We need member states to accompany us to meet these targets and donors to support the UN to provide the expertise each agency brings so that we can jointly meet these challenges. The WMO community stands united with WHO and health partners to take a stronger climate action together. I thank you very much.
Thank you very much indeed, Professor Salo, and can I just compliment you on really stressing the importance of cutting emissions. That's a message we don't hear enough of because we're not going to adapt our way out of this emergency. We're now going to have some brief statements from colleagues on the floor, and we're going to begin with a 2-minute intervention from the representative from Colombia, who's going to announce the second WHO Air Pollution and Health Conference. Please, the floor is yours.
Thank you. Gracias.
Thank you very much, Dr. Horton and Dr. Tedros. It's an honor for Colombia to be the host country of the second global conference on air pollution and health, which will be held in March next year. On behalf of the Colombian authorities and our president, Mr. Gustavo Petro, I'd like to thank you for the invitation and confirm to you that we will be the host country because we think this is an important opportunity to do more to tackle the climate emergency from the point of view of protecting life in all its forms and promoting social justice. You'll be very welcome in Colombia. Thank you.
Thank you so much. Let me turn now to Brazil and Mr. Carlos Gadelha, Secretary for Science, Technology and Innovation and the Health Economic Industrial Complex and the Ministry of Health, who's going to talk about the Troika alignment on health and the climate change nexus. Please, the floor is yours.
Is it working? Thanks, moderator, Dr. Tedros and Excellencies. Climate change is one of the foremost global threats with strong impacts on our people and the economy. The impacts on human health and the health system are increasing and complex. Under the leadership of President Lula, health for all is a priority, considered as a quality of life and well-being. Climate and health are strongly associated with countries' inequalities, impact the most vulnerable population disproportionately. Brazil has taken proactive measures to climate-sensitive disease, neglect disease and population such as arboviruses, and priorities in our public and international health agenda. The global model of production and consumption is the structural cause of climate change. Health production itself is one of the main opportunities for a fair economic and ecological transition. In the south of Brazil, we are facing the effects of climate change. It's dramatic. Due to floods, there are more than 540,000 people displaced. Health care is being provided through our universal system. Additionally, emergency cash transfer is being delivered by the government to the families affected, among other measures related to the social determinants of health. This crisis underscores the urgency of inserting climate change at the heart of the public health agenda. During Brazil's G20 presidency and for COP30, this agenda is a priority. To conclude, health must be considered a sustainable development driver of a necessary structural change that involves economy, society, and environment. The health economic industrial complex has a central role to transform the productive pattern to orient public and private investment for people's lives and the planet. Health is ecological transition and sustainable development. Thank you very much.
Thank you very much. Now, we've heard a great deal already today about the importance of the World Health Assembly resolution on climate and health, and it's a really great honor to give an opportunity for representatives from two countries that played a pivotal part in making that resolution happen. From the Netherlands, Mika Moltov, and from Peru, Vanessa Aliaga. The floor is yours.
Thank you, Dr. Horton, Dr. Tedros, distinguished panelists, and ladies and gentlemen. Thank you for, first of all, donating your Saturday lunchtime to this critical issue, especially after such a heavy week. And I am not going to be able to speak to the urgency of addressing the impacts of climate change on health in a more eloquent fashion than our expert panelists have already spoken to. I just want to take this time to say that it is precisely because of the compelling arguments that we've heard, because of the data that the previous speakers have mentioned, that the Netherlands and Peru felt compelled to present this resolution at this World Health Assembly. It was of critical importance that it be now. So we're really pleased that after a long and challenging negotiation process, we were able to get this adopted by this World Health Assembly. And before addressing the specific content of the resolution, which I think my esteemed co-chairs from the Netherlands will speak to in a second, I want to say that it is an enormous pleasure for Peru to participate in this dialogue, but also to contribute with this resolution to allowing the WHO to continue to broaden its work in this critical area. We feel very honored to have played that role. We trust that the WHO will implement this resolution with the sense of urgency that it requires. Perhaps before giving the floor over to Mika from the Netherlands, I wanted to give a few thanks. First and foremost to the Secretariat, to Dr. Maria Neira, to Dr. Djarmid Campbell-Ledrum from the Secretariat, for all of their support throughout this very long and difficult negotiation process. Not only their expertise, but their sunny disposition really made all of the difference. So truly thankful also to the member states that expressed support for the resolution, our co-sponsors, and just generally the membership from the WHO for maintaining flexibility and a constructive approach throughout the negotiation. It was very thankful for that. And of course, to my fabulous co-chairs, Astrid and Mika from The Hague, who is behind the scenes, but our mastermind. Thank you so much. So over to you now, Mika.
Yes, thank you very much, Vanessa, and thank you as well for being a wonderful co-chair. We couldn't have had a better co-chair, I think. When developing this resolution, we deliberately sought to carve out a proactive role for member states, alongside that of the WHO Secretariat, one that spans the full spectrum of adaptation, mitigation, as well as loss and damage. This means not only being ready to respond, but also preventing and shaping future trends. We hope this resolution will thereby guide countries to take the urgently needed action on all fronts, with a strongly integrated, cross-sectoral and forward-looking approach. With this resolution, we build on the COP28 declaration and stipulate the next steps. First of all, the development of the first ever global plan of action on climate change and health, to be developed, of course, in close consultation with member states and relevant stakeholders. Second, taking accelerated measures on climate change and health within the new general program of work. Third, having member states step up both national and international investment in building climate resilient and sustainable health systems. This means not only working together on national plans, but also exploring the opportunities for innovation, co-benefits, and integrated financing, as well as working more closely with UNFCCC. Finally, we asked the Secretariat to develop a net zero roadmap towards 2030, to inspire, but also serve as a global leader in the field of climate and health. We now very much look forward to the path ahead. Thank you.
Now we have two very special guests with us who've worked a lot harder than all of you have to get here today. And I'd like to introduce Heather Lambert and Chitika Piacina. Please stand up so everybody can see you. They have ridden They've ridden all the way from London to be here, so I'm going to give them a chance to say a few words about their trip. It's so good to see you both here.
Thank you, Dr. Horton and Dr. Tedros, and to the organisers for the invitation to be here. We are children's doctors from Ride for Their Lives. We cycled 550 kilometres from Paris to be with you today. Ride for Their Lives is an international collaboration of healthcare providers riding bicycles, carrying messages from children in this blue bag, and advocating actions to protect the planet for our patients and children. Climate change and air pollution are the biggest threat to child health worldwide, and we see this in our day-to-day clinical practice. We congratulate the WHO and you all in the passing of the climate change resolution this week. We started our journey on Sunday, cycling around London, celebrating what cities and communities can do towards promoting clean air and health. And this was on the backdrop of a newly re-elected mayor boldly tackling air pollution.
Air pollution is an invisible killer. As advocates for children, our ask of you, the policymakers and leaders, is to act now on the commitments of this WHO resolution and to use health arguments to take bold actions that result in reducing air pollution and climate change. As doctors, we are used to writing prescriptions, and the WHO resolution is kind of like a prescription to you all. But we know that prescriptions only work if the actions prescribed are actually followed. Children are demanding this. They cannot take action alone. They have little voice and they can't vote. You all have a responsibility to protect their health and their future. Thank you so much for inviting us here and letting us speak.
Fantastic. Thank you so much for being with us. It's such an honor to have you here. Let me immediately turn in a complimentary way to WHO's Youth Council, who has some important words for us today. Please.
Distinguished delegates, we are the WHO Youth Council, WHO's very own platform for meaningful youth engagement, and climate and health is at the heart of our work. Today we stand at a pivotal moment in history. With half of the world's population under 30, youth is carrying and will carry the heaviest climatic burden of all untaken measures. We simply cannot afford the luxury of not implementing and abiding by the resolution and other high-level climate documents, and neither do our health systems. We are the generation that will inherit and live the longest with the consequences of the decisions that are made or not made today, and we are tired of hearing that we are the future. The proverbial future is now. We need strong and urgent action from current leaders and decision makers instead of putting the burden of saving the planet on our shoulders. Otherwise, there'll be no tomorrow, no future for you nor for us. We would like to congratulate the WHO and thank member states for their support towards achieving monumental decisions such as the Climate and Health Resolution from this WHO and the declaration from COP28. However, they should not and cannot become a glass ceiling. Moving forward, we have to push for greater gender inclusivity and recognize that without gender equity, we cannot achieve climate justice. We also feel that the conversation about fossil fuel phase-out at this WHO was lacking, and we are worried that the world's continuous addiction to unsustainable energy sources will destroy our planet even further. An immediate alignment between different high-level processes is crucial. We keep hearing about the need for a non-siloed approach, and yet we're extremely disappointed to hear that there are entities that are still blocking the progress of working on climate change and health across different sectors and UN processes. For example, it is impossible to say in the face of all evidence that the plastic treaty has no impact on health, or that climate discussions should be kept only to the environmental fora. Youth is the driving force of climate action, and building on the resolution on social participation, we call on the WHO, member states, and other stakeholders to invest in us by opening more doors, empowering us through building our capacities and supporting us through financial and other means, truly ensuring intergenerational collaboration on climate change and health. Thank you.
Thank you so much. Your words hold us accountable for our promises and commitments, and I'm grateful for them. We're not going to affect worldwide change from people of my age. It's going to require generational transformation. And at this point, I just want to acknowledge the inspiring work of a French primary care pediatrician, Dr. Christine Magendie, who writes a letter to you all. Dear World Health leaders, in the run-up to the World Health Assembly, I asked children what they hope politicians will do to help them grow up healthy. here are their messages to you. And I have here a whole collection of their messages to you about stopping smoking, about recycling, about protecting our environment and our forests, getting rid of plastic from our communities, stopping driving cars, building cleaner and greener cities. I will leave these at the front at the end of this session so that you can take a look at their inspiring and creative work. It's going to take all of us on this planet to change the direction of our travel, and Dr. Magendi has shown us a way. Let me move to the next intervention from the United Kingdom, please.
Thank you so much. I think many of us sat in this room this time last year, and I'm really struck by the momentum. Largely thanks, Dr. Tedros, to your leadership and so many of those sitting here in the room today. We clearly need to pick up the pace. We're hearing that loud and clear from many of the speakers today. I represent the UK on many of the boards of the global health institutions. And one of the things that I think we can do here in Geneva is step up our collaboration between the global health institutions and step up our collaboration in partnership with the other institutions, the IFIs, the Green Climate Fund, and so many more, to really come together behind country priorities. There is no room for siloed working in the climate emergency. And so we really do, this year, need to accelerate our collective efforts to work together to really ensure that we are maximizing our collective offer behind the climate and health agenda. Thanks.
And from the Global Fund, please.
Good afternoon, colleagues. Climate change represents a profound threat to decades of global health progress. We are seeing the impact in the countries we support, particularly in malaria and efforts to build strong health systems, but also complicating the fight against HIV and TB, still currently the world's largest infectious disease killer. Climate change is triggering public health emergencies, undermining access to essential health services, prevention, diagnostics, vaccination, and treatment. Extreme weather events are driving health crises, population displacement, and food insecurity, leaving communities already vulnerable even more vulnerable. Vector-borne diseases, as we've heard, are on the march. Dengue, Zika, and an increasingly chaotic and moving malaria map are making populations never before exposed to these diseases newly affected. And not yet mentioned today, but also widely recognized, is that warming is increasing the risks for pandemic emergence by increasing activity at the human-animal interface and therefore accelerating pandemic risks. Yet despite this accumulating evidence, there is a significant lack of investment into health sector climate resilience and mitigation mechanisms. The Global Fund is strongly committed to addressing the impacts of climate change on health and promoting climate resilient and low-carbon health systems. Climate change is a critical aspect of our strategy, and already over 71% of Global Fund funding goes to the 50 most vulnerable countries, recognizing that those vulnerable countries also suffer large health disease burdens and are often fragile in conflict-afflicted states. Climate finance flows are far off what is needed for even the lowest climate adaptation cost estimates for developing countries. That is why, together with WHO, the World Bank, the Green Climate Fund, the Rockefeller Foundation, and other attached partners, we are working together to increase the quality and quantity of climate-related health financing to deliver tangible results for the most vulnerable populations. We work together to ensure that climate health financing needs are accountable and predictable, that it builds on existing health systems efforts and country-owned models of health financing, grounded in the core principles of country ownership, equity, and measurable impact. We'd like to express our heartfelt gratitude to WHO and the ministers here for your unwavering commitment and leadership in prioritizing critical issues of climate change and health. We will be with you in this fight. Thank you.
Thank you so much. So to summarize, this strategic roundtable has begun to draw the contours of a global vision for action against the climate crisis. But it's easy to feel overwhelmed by the scale of the challenge before us. So we must keep our focus very clear. Climate change is a threat multiplier. It exacerbates hazards to people's health and worsens the dangers that health systems already face, which is why we need to take account of and incorporate climate action into all of our health policies. The health sector, you, myself, we have a key part to play, not only in decarbonizing our own health systems, but also in delivering transformative health interventions, improving air quality, improving diets, physical activity, building safe and green urban spaces to achieve healthier populations and to decrease greenhouse gas emissions. And of course, our role as activists and advocates to keep fossil fuels in the ground, to invest in renewable energy and to protect nature and biodiversity. So to conclude this section, it's a great pleasure for me to introduce Dr. Hans Kluge, the Regional Director for Europe. Please welcome him.
Thank you very much, Richard. Dear Dr. Tedros, Excellencies, ADG Alan Lee, Dr. Marinera, and my friends. Collective action now. These are our marching orders following the adoption of the GPW 14 and the new resolution on climate and health adopted at this WHA. First, collective, reflected by the collegiality of our just concluded roundtable. At a time of division globally, we have demonstrated how consensus still can be achieved. Second, action, moving from words to concrete, very practical measures. As my brother, the Azerbaijani Health Minister Timur Musayev has shown, for example, incorporating curricula on climate change and health for second-year medical students. Congratulations, sir. And third, now, reflecting the greatest sense of urgency, as we heard from Right for Their Lives pediatricians and the WHO Youth Council. And we see a clear, encouraging trajectory. The strong climate and health lead set by the UK at COP26 in Glasgow. Then the unprecedented step at COP28 last year in Dubai, with a full dedicated day to health. Shukran Jazilan, Dr. Sultan Ahmed Al-Jaber, COP28 President and UAE Special Envoy for Climate Change. And this November, at the COP29 in Baku, the continued emphasis on health and human capital within the global climate agenda. Soh Sagolun, Dr. Timur Musayev. All of this, a strong foundation leading up to the COP30 in Belém, Brazil, next year. As the WHO Europe Regional Director, I'm so pleased to see more and more member states joining the Alliance for Transformative Action on Climate and Health, but also the new regional partnership on climate resilient health systems, launched at the 7th Ministerial Conference on Climate and Health in Budapest last year. This Budapest Declaration reflects the commitment of all 53 of our member states across Europe and Central Asia to addressing the triple planetary crisis, helping to mainstream climate change into health policy domains, underpinned by our WHO European Centre of Excellence for Environment and Health in Bonn, Germany, so ably led by Francesca Racioppi and her wonderful team. As we heard from the Excellencies from Fiji and Cape Verde, we should not forget that island developing states, including the Pacific island countries and areas, make up 2 out of 3 of the countries worldwide that suffer the highest relative losses from disasters. Here, I will endeavour to support all my colleagues, and especially, I see here my brother, the Regional Director of WEPRO, Dr. Saya, in the room, and I know about his extraordinary commitment. Director General, my friends, let's not forget, while we are gathered here, millions of people are suffering from climate and environment-related impacts globally. The massive landslide we saw in Papua New Guinea, scorching temperatures in South Asia, extreme rainfall in Dubai, and severe flooding in our own Caucasus, to name just a few. No region is immune from the devastation of climate change. We must stand united, sharing knowledge, resources, and an unwavering commitment above all. Collective action now. Our very existence depends on it. Thank you.
That's it. Live safely, travel cleanly.